The nerve which supplies the diaphragm. The nerve which supplies diaphragm. Option A, phrenic nerve. Option B, sciatic nerve. Option C, trigeminal nerve. Option D, accessory nerve. The correct answer is option A, phrenic nerve. Phrenic nerve is a mixed motor and sensory nerve passed through the neck and thorax to innervate the diaphragm. Originated from C3, C4 and C5 nerve roots, phrenic nerve plays a major role in respiration. Damage of phrenic nerve leads to paralysis of diaphragm. It affects the lungs' ability to exchange air. Common cause of paralyzed diaphragm are Guillain-Barré syndrome, trauma to an infant during labor and delivery, cervical spondylosis, complication from neck surgery, heart surgery and chest surgeries, multiple sclerosis and spinal cord injuries. Cushing's triad is option A, high blood pressure, edema and oliguria. Option B, slow pulse, abnormal breathing pattern and high blood pressure. Option C, hypoxia, increased temperature and tachypnea. Option D, slow pulse, hypoxia and pupillary asymmetry. The correct answer is option B, slow pulse, abnormal breathing pattern and high blood pressure. Cushing's triad refers to a set of signs that are indication of increased intracranial pressure. It consists of bradypnea, bradycardia and hypertension. Which vein is the common source of thrombi that become a pulmonary embolism? Option A, great saphenous vein. Option B, femoral vein. Option C, popliteal vein. Option D, posterior tibial vein. The correct answer is option A, great saphenous vein. Great saphenous vein is the large subcutaneous superficial vein of the leg. It is the longest vein in the body. A patient is brought to emergency department with diabetic ketoacidosis. In the acute phase, priority action is option A, administer sodium bicarbonate. Option B, administer 50% glucose. Option C, administer IV insulin. Option D, monitor ECG. The correct answer is option C, administer IV insulin. Administer an IV bolus of regular insulin followed by continuous infusion of regular insulin and monitor blood glucose level. Diabetic ketoacidosis is a life-threatening condition caused by relative or absolute deficiency of insulin. Common clinical features of diabetic ketoacidosis are hyperglycemia, acidosis, dehydration, and electrolyte imbalance such as hypokalemia, hypocalcemia, hyponatremia, hypomagnesemia, and hypophosphatemia. While carrying deep vein thrombosis, which among the following is most suitable? Option A, out of the bed, do activities as desired. Option B, bed rest with affected leg flat. Option C, bed rest with elevation of affected extremity. Option D, bed rest with affected extremity in a dependent position. The correct answer is option C, bed rest with elevation of affected extremity. A patient is in sinus bradycardia with heart rate 45 beats per minute, complaining dizziness, and his BP is 80/60 mm of Hg. Which of the following should be priority intervention? Option A, defibrillation. Option B, administer digoxin. Option C, monitor and observe. Option D, prepare for transcutaneous pacing. The correct answer is option D, prepare for transcutaneous pacing. Indication of transcutaneous pacing are hemodynamically unstable bradycardia that are unresponsive of atropine, symptomatic sinus bradycardia, Mobitz type 2 second degree AV block and third degree AV block. When a patient is continuous bladder drainage, the bag should not be raised above the hip level. Option A, because the bag may fall down. Option B, because the catheter may be pulled out. Option C, to avoid return flow of urinary bladder. Option D, because it may cause bleeding. The correct answer is option C, to avoid return flow of urinary bladder.